The healthcare industry in America leaves so much to be desired. Medical debt is increasing, billions are lost in unpaid claims, hospitals are in the red, service prices can range up to 30x. But that's not all.
Nobody knows the price of healthcare. When we say nobody, we mean nobody.
It's unaffordable, opaque, and it's becoming a leading category for viral memes as a result.
Around 50% of every dollar that is being invoiced is being uncollected. That's unheard of.
Healthcare, broadly known and understood to be among the worst consumer purchasing experiences.
We have definitely talked to some clinics where if they don't get paid 1 month, they literally can't make payroll.
What is actually being unwound is the backbone of healthcare for a very large portion of the country. And so I think it's going to just blindside and surprise a ton of people.
As part of this short 6-video series on the emerging intersection between healthcare and fintech, we talked to the founders trying to modernize the $4 trillion healthcare industry, together with the help of fintech. As a reminder, the content here is for informational purposes only. Should not be taken as legal, business, tax, or investment advice, or be used to evaluate any investment or security, and is not directed at any investors or potential investors in any A16Z fund. For more details, please see a16z.com/disclosures. In this video, we discussed the notoriously complex medical billing cycle in the United States. It's so complex that around 50% of every dollar invoiced is not even being collected. It's so complex that even people who can pay struggle to do so. Here is Florian Otto, co-founder and CEO of Cedar, a company that's trying to simplify this incredibly complex billing process. Here, Florian discusses the lack of innovation and how it's actually hurting all parties involved. But also, while the number of scientific papers published each year continues to grow, why those advances don't seem to be making it into the pockets of consumers.
The medical piece is very different, I think, from the administrative piece. On the medical piece, I think there have been amazing innovations over the last 50 years or something. I mean, we just compare right now on which kind of robots are in the operating rooms. You have positron emission tomographs, you have MRIs everywhere. So it's really amazing on what you see there. When you see on the administrative side, I think it's still completely stuck kind of in the 80s, right? So you literally have the fax machine still there. You're still having checks being mailed right and left. And you still have something like prior authorization. Different parties trying to fight over literally what is good for the patient or not. So my opinion is the medical side actually has seen huge improvements. The administrative side has really lagged behind.
Not only does this complexity result in a painful experience for patients, but it's actually hurting the revenue of healthcare providers as well.
Around 50% of every dollar that is being invoiced is being uncollected. That's unheard of. You have never heard that in any other industry, that only 50% of everything that gets billed gets paid. It's completely crazy. And when you enable it, make it easy for patients to pay, that amount increases.
In fact, Florian's own personal experience dealing with the complexity of a payments process is exactly what inspired him to create Cedar.
Yeah, impetus for starting Cedar was my wife had a really bad billing experience based in New York. She fainted on the street, was admitted to the emergency room, and then we had a terrible billing experience. So swiped credit card for the co-payment, needed to pay $250 for the co-payment. So far, so good, but was not the right time actually to pay when you really are concerned about what's going on with a loved one. Then a month later came the first invoice. Everything was written in strange codes. It was really tough for her to pay. Another month later came the imaging center bill, and then half a year later, a debt collector called her because of a bill from the lab company that she never received. So overall, what was really interesting, she basically said, "Never take me back to that hospital," because she lost trust in this. So if the billing is so messed up, she also lost trust in the medical side.
We all know that Florian's experience is not an isolated one. Unfortunately, multiple surprise bills, invoices occurring 6 months later, and incorrect charges being billed are problems that Americans are becoming far too familiar with. But it does not have to stay like this. and companies like Cedar believe it won't. With recent advances in machine learning, software is emerging that actually personalizes and simplifies the billing process.
And then we know what is the insurance plan. That's also another data point. So that infers, is it a blue collar, is it a white collar plan? Then, of course, we know what is the demographics of that, of a certain patient, because we have date of birth, right? And then we have past payment histories or past engagement history. So we know whether they defaulted already on certain invoices or not. And together with that, you can come up with basically a hypothesis on what is the best outreach. And that's, of course, what these machine learning algorithms are doing. So we use these multi-armed bandits, they're called. And then based on how the patient clicks through the app, that gives us another set of data, which is engagement data. And together with this engagement data, then of course the follow-ups are different. I mean, it's the same when you shop on Amazon, they get you to check out the shopping cart in a nice way. And we use these same algorithms that basically nudge the patients throughout this process and personalizing all of these cascades.
And this simplified experience isn't just something consumers want. It's actually something that healthcare providers need and also are pushing for.
Of course, for a hospital right now, margins are extremely thin. So when you consider a health system, for example, of $1 billion in net patient service revenue, they probably get around 50 million from patients directly. If you right now increase that by 30%, that gets you 65 million. So it's a delta of $15 million to the bottom line. It's 1.5% additional margin, right? Out of $1 billion. And when you before Cedar only had a margin of maybe 1 or 2 or 3%, getting additional percent or 1.5% is of course very impactful.
While simplifying the entire payments process in healthcare is easier said than done, companies like Cedar are beginning to slowly chip away at this problem. Their method? Personalization.
Using modern technology to personalize the billing experience and give patients the same experience that they're expecting from the healthcare system that they're experiencing at any other consumer-facing industries, like when they hail their Lyft or they book a trip on Expedia or watch Netflix. Yeah, of course. When you basically right now go to the healthcare system, everybody gets the same invoice after 30, 60, 90 days with the same amount of codes. Nobody really understands that. And this one-size-fits-none solution is not really the best to interact, right? Because for some people, the problem to pay is maybe understanding English. For another one, it might be they don't have the money to pay. For another one, it might be they're not always at their home to get the bill. So what we're basically doing is we want to reach the patients where they are with the methods of communication on what applies to them. So for example, some patients might get where convenience probably matters. They might get a text message at 8 a.m. in the morning with a call to action, 1 click to pay. Another patient might get an email in Spanish at 4 p.m. with a call to action, pay as little as $50 every other week on a payment plan.
In the bigger picture, personalizing payments is just the first step toward a larger goal of ensuring that both healthcare providers and patients can focus on what matters most, the quality of healthcare provided.
Not go to the doctor because they're afraid of how much something costs or that they are not able to pay for something. That is really something that totally breaks my heart. In a country like the US that is so wealthy, it just can't be that people do not go to the doctor because they don't have the money for it, or they're afraid because they don't have transparency on how much something will cost.
So what do you think? Can we rebuild this broken system? Where do you see the biggest opportunities for disruption in healthcare? Let us know in the comments below. And if you like this video, be sure to check out our next installment with Juniper, a company simplifying recurring healthcare payments for clinics, like the ones that serve approximately 6 in 10 Americans with a chronic condition. And if you'd like to learn more about how fintech is revolutionizing healthcare, head on over to a16z.com/healthcare-meets-fintech, or click on the link in our pinned comment. Thanks for listening to the A16Z podcast. If you like this episode, don't forget to subscribe here on YouTube to get our exclusive video content. We'll see you next time.